Reiki Practice, Spirit and Life Force Energy by Jean Bissett, RN, for Vermont Technical College's BSN program. Hi, my presentation is intended to discuss adding Reiki to the general care of patients in an effort to reduce stress, anxiety, fatigue, and pain in multiple healthcare settings. The presentation is intended for the learner to have a deeper understanding of Reiki energy healing. It will discuss a history of the practice, legal and ethical concerns, scientific evidence, and evidence-based practice of the treatment. It is intended for nurses in all care settings to have a deeper understanding that Reiki is an adjunct to treatment, and will recommend that nurses partake as a way to care for themselves and their patients in a holistic manner. There are 3 levels of Reiki practitioners. They are taught by a master who opens a chakra with sacred symbols that are transferred to the student. Level 1 focuses on natural healing ability of the body, and Level 2 has a deeper understanding of the energetic flow. Introduction of symbols to aid in treatment are introduced in this stage. In Level 3, practitioners' inner spiritual develops and spiritual consciousness as well. The practitioner is thought to be in a meditative state and allows energy to flow where it's needed. Reiki is classified as a biofield energy therapy by the National Complementary and Alternative Medicine. When a person chooses to be a nurse, they have made a moral commitment to care for others, regardless of healthcare needs. The Code of Ethics for Nurses supports this, as it states, "The nurse respects the worth, dignity, and rights of all human beings, irrespective of the nature of the health problem." Reiki is a non-invasive treatment with low risk for harm. The intent with this presentation is that nurses understand what the practice involves and to be open to adjunct treatments, while also understanding the ethical considerations that nurses worry about. Reiki does not require licensing, therefore we need to teach our patients to find practitioners with a good reputation and that may be also certified. Some of the main ethical considerations I find important are autonomy, which is a right of an individual to make personal choices. Beneficence, which is the practice of health and general well-being of others. Understanding complementary and alternative treatments is a nursing responsibility to make sure that no harm is done to our patients. When we understand the treatment, then we can then understand what the patient needs and is trying to achieve. Also, one of the main concerns is informed consent. The ability to make an informed choice requires that all information be gathered during the decision-making process. As nurses, we are in a unique position to educate on the risk benefits of all alternative treatments. Here's a little history on Reiki. It is believed to have dated back thousands of years in Tibet, was lost and refounded in the 1840s by a Japanese monk who is considered the founding father. His name is Mayako Ushi. After World War II, all Eastern modalities of treatment were banned in Japan and only Western modalities practiced. Reiki was kept alive by underground practices. In the recent past, nursing has been the leading force in Reiki therapy in the hospital settings. Nurses have explored the idea of energy work for a long time. The first known nurse to explore alternative treatments was Dolores Caring in the 1970s, who pioneered research with therapeutic touch. The Holistic Nurses Association has a position statement on complementary and alternative medicine. It endorses non-invasive energy work as a valid nursing intervention to render a holistic care to the self and others. Little research has been conducted on Reiki practice. The research for Reiki continues to lack concrete evidence that it is an effective modality of treatment. On the positive side, some of the research that has been conducted on Reiki does reduce pain, and some studies have also shown a positive effect on patients and families. The findings of the literature suggest more research with more rigor should be conducted to add this modality as an evidence-based approach. Scientific evidence of the mind, body, and spirit. The National Institute of Health and the National Center for Complementary and Alternative Medicine classify Reiki as a biofield energy. Energy flows through the practitioner to the recipient, allowing healing of the spirit, mind, and body. Case studies and exploratory research have found the following as listed benefits of Reiki therapy: relaxation, pain relief, physical healing, reduced emotional distress, and a deepened awareness of spiritual connection. Also found are physiological changes: a reduction of anxiety and stress, a reduction of fatigue, and it has a positive effect as an adjuvant to opioid treatments. Studies have been conducted that have associated Reiki treatments with various physiological changes, including increased salivary immunoglobulin A levels, hematocrit and hemoglobin changes, and alterations in heart rate, respiratory rate, and/or blood pressure. Other effects that Reiki can have are that it relieves pain, clears emotions, cleanses toxins, balances mood, reduces blood pressure, clears life blockages, and enhances organ function. Nurses working in the hospital have come to understand the value and contributions of complementary and alternative medicine, such as Reiki, which is an intentional healing process that calls on the healing power of nature. One of the most important teaching points I feel to include is that Reiki promotes a moment of quiet, helping the participant to be less overwhelmed, sleep better, and participate more actively in decisions of care. The National Center for Complementary and Alternative Medicine, or NCAM, note that there is an increase in the amount of individuals participating in alternative medicine. Americans annually spend between $36 and $47 million on alternative treatments. 1.1% of the population, or 31,000 participants in a study on complementary and alternative medicine, reported the use of Reiki in the year before. This is important for nurses to recognize the increased use of alternative therapies and understand how they can be incorporated into practice. When attempting to heal with Reiki as a holistic approach is applied, I chose to implement Gene Watson's theory of human caring with Reiki practice. The theory has an emphasis on the caring relationship. The belief that there is a greater healing force present in many cultures makes Reiki practice an acceptable treatment for many of these cultures. The participation of this technique is not limited to one culture, and the participation in this technique is not limited to believers or non-believers. A recent change in the view on energy and spiritual healing has been incorporated into the Christian faith. For years, the belief of Christians have been opposed to mixing the healing of the East and West. Within the last century, this view has changed. For this part of the presentation, I chose to add pictures of Reiki healings because I wanted my treatment to be individualized and personal. Here it shows that you can have no touch, light touch, and that the environment is calm and relaxed. My collaboration with a Reiki practitioner. My goal was for me to relax and be grounded. My intent was to be as involved and immersed in the treatment as much as possible. The practitioner and I decided not to allow the session to be recorded or photographed so that I would receive a true healing session. What I learned about Reiki. Reiki is beneficial to the healing of the whole person, mind, body, and spirit. It is becoming more popular as a modality of treatment. can be incorporated in any setting as it allows patients to participate more actively in their care choices. And healthcare professionals should take care of themselves spiritually as well as physically. Participating in Reiki is an easy way to make that happen. This is my reflection of the project and how everything went for me. I learned a lot more about Reiki than I thought I was going to. I just got back from my healing session today, and taking it from a nurse, I learned that we need to take care of ourselves. And whether you believe in energy healing or not, you need to take the time to practice and take care of yourself. I learned today that I'm on the right path. Angels and guides are in the right places. I was grounded and felt heavy in my root chakra, which is my area of my hips. And during the session, I felt definitely weighted, like lead was in my hips. It wasn't a bad feeling. It was a good feeling. And I had felt toward the end of the session shaky, that I had felt shaky before. But it was a good shaky. It was things releasing and letting go for me. So taking home from Reiki practice is that you need to take care of yourself, and Reiki healing is one of the ways to do that. I hope you enjoy. These are the final thoughts that I want you to take home from this presentation. Reiki is a non-invasive treatment for all ages. It promotes healing of blocked energy and is an approved treatment by the American Holistic Nurses Association. Reiki does assist in an optimal healing environment with caring and peace at the basis of treatment, especially in high-tech, high-stress areas. I hope you find this presentation informative, and I encourage you to find a practitioner in your area.